Hi, everyone. Thank you for having us here at the Healthcare Innovation Texas Summit. We're excited to be here representing Houston Methodist. My name is Josh Soul. I'm an Administrative Director for Innovation and Ambulatory Clinical Systems. Today, Brad Shank and I will be presenting the art of the possible, doing health system innovation right at Houston Methodist. Brad, do you want to introduce yourself on camera?
Hi, everybody. My name is Brad Shank, Administrative Director, Innovation and Business Systems here at Houston Methodist. It's great to be able to present with you today, and I hope you really gain a lot from it, and we look forward to taking any questions that you might have.
So we're really excited to be here to share the art of the possible, doing healthcare system innovation right at Houston Methodist. As part of our journey, we wanted to share a little bit about Houston Methodist. We are a 6 community hospital, 1 academic medical center in the heart of Texas Medical Center in Houston, Texas. We put the patient in the center of everything that we do, focused in on about 1.2 million outpatient visits, 1.3 clinic visits, and you can see some of the accolades that we've received over the past few years. I like to start off all of these innovation presentations with a quote from Charles Darwin. It's not the strongest of the species that survives, nor the most intelligent that survives. It's the one that is the most adaptable to change. And that's important, as healthcare is in the midst of a digital evolution or revolution, some may say. We're in the era of really focusing on big data and usability. It's our turn to innovate. It's our turn to put that innovative mindset out there to help treat our patients, to help our users use our systems more and more every day. We had choices at Houston Methodist, and you'll have choices too in your organizations, to either be Uber or to be Ubered. I know the pandemic has caused a lot of different consternation across the healthcare industry. However, you have to think about innovation and look at the taxi cab compared to Uber. You look at your Yellow Pages compared to Google. These different institutions have gone by the wayside. That's because they have faced innovative entrants into the marketplace. We have to be able to play with those innovators, be able to treat our patients just like if they were a consumer. The new norm is here. Mobile, digital, automated, value-driven. You as innovators, we as innovators are also going to be coming up with the new buzzwords in the future. What is that new normal? Rather than trying to predict what that future looks like, we'd really want to focus on the customer, creating agility in the healthcare industry, and then leveraging our innovative mindsets to really break down barriers for digital innovation and user experience. At Houston Methodist, we developed a steering committee of sorts. It started off as a book club, candidly called DIOP, Digital Innovation Obsessed People. It's leaders from across our institution that bring innovative mindset into this book club, and we talk about it on a weekly basis. Started off as a month-long, 1 hour at a time, talking about how different parts of the organization are innovating, who's doing something special, how can we do it over here. It's been a really special group. Started off as 1 time a month, then it moved to 1 time every 2 weeks for an hour. Now it's up to 1 time a week for an hour and a half, talking about innovation, talking about how we can disrupt and positively transform healthcare delivery. As we work to transform these different visions, we have 4 that we're really focused in on. We believe that our employees are superheroes. We believe in automation. We believe in allowing our employees to be and work at the top of their license, to be those smart, intelligent humans that we hired them to be, and allow robots to do the monotonous work. We have a concept called Know Me. Know Me is focused on our patients and knowing those consumers who are using the technology. We're treating patients at their most vulnerable time. We should at least make them feel like we know who they are. And through the technologies that we're focused in on, we're trying to and working towards our patients feeling that every day. We want to empower ideas. We believe that 25,000 employees at Houston Methodist can innovate. They just need a chance and a forum. We also want to be an innovation leader across the world. We are building new technologies. We are taking on new approaches to delivering healthcare, to be a global thought leader. That is our goal, and we challenge you guys to be that same group. Our guiding principles: everybody's responsible. As I mentioned before, we have 25,000 employees at Houston Methodist. We believe everyone's responsible to innovate. We know you can do it. We know we can innovate healthcare. We want to be transformative as we go through it. We're not working on a 1x change, we're working on a 10x change. How do we change the status quo? Focus on research and development. We partner with our research institute and our centers for outcomes to measure our innovations. How are we impacting our patients? How are we impacting users? Can we focus on usability here? Can we watch eye movement there? Research and develop strategies to be able to make this technology really work. And then, of course, there's the succeed fast, fail fast methodology that we put into place. We are agile in nature, and it's okay to fail. Failure is not a bad word. Failure is a learning opportunity. And we take those opportunities every time we look at a new solution and we ask ourselves, is the mission right? And did we try our best to make it work? We all had plans during COVID in 2020, and we all had plans in 2020, and then COVID hit. So it really adjusted our plans. But we wanted to highlight that we really were working on innovation throughout the midst of the pandemic, and we still do to this very day. We push hard on innovation as an organization. And for those of you in the audience, to make real change, you have to focus in on innovation. And so in 2019, you can see our project portfolio. We like to group them into 4 different quadrants: graduates, pilots, pipeline, and the rest in peace category. And the rest in peace category isn't a bad thing. It's just it was a pilot that failed. The question is, was the mission right? Did it make sense? Was it the right vendor? We don't always know that right at the start of the pilot that we work through. However, we try to reflect and look at any failure that occurred to do better the next time. But in 2020, and if you look at the time frame, we increased our innovation that went across the institution from 23 projects in 2019 to 34 projects in 2020. Innovation is ripe for transformation right now in healthcare. The pandemic has forced us to look at ways to transition and transform how we deliver these healthcare solutions. We continue to innovate. We continue to push forward throughout the pandemic. Brad, I'll turn it over to you.
Thanks, Josh. Houston Methodist is using technology to ease the patient journey. We're truly focused on transforming the way patients are seeing our doctors and really making a more accessible care than ever before. One of our goals is to take a complex system and make it more accessible for our patients. Another goal we have is to create an unparalleled experience for our patients. To do this, we're building partners across industries, and you saw a lot of logos on that last slide. Because we are all the same, whether we are a patient or whether we're at our favorite store. We all desire help now. But at Houston Methodist, with our patients, we're doing that by translating it through convenient care anytime, flexible and easy scheduling, and digitally engaged patients, because people don't want to wait. We're trying to make it easy, and we'll show you through this presentation some seamless check-in options and follow-up processes, and we're trying to make it clinically efficient workflows. You'll hear more about that. We know that people will go elsewhere otherwise. And Josh spoke about Know Me, and Know Me means remember me. Through enhanced communication, be proactive with the patient, transparent with data and information, really connect their experience in a rich way. Because people are not just a number. A great example of this is with communication. A problem that we saw 3 years ago at least was ineffective scheduling communication. We were using an antiquated system that had delayed appointment reminders, like even the next day after the appointment. High no-show rates, multiple reminders. Patients were just really getting bombarded by different systems, manual processes. We all know that feeling. We implemented a new solution that was groundbreaking in the industry, and ours was an enhanced bidirectional communication capability. Leveraging this technology, we were able to expand and communicate directly in the way people like to be communicated with via text. We really leveraged this during COVID. We utilized it to help people schedule their COVID lab tests via text. And this just shows you on this page how getting one text and clicking one link allowed patients to immediately schedule a time that was convenient and easy for them. We're also creating frictionless digital navigation experiences for our patients. We're focused on helping ease the burdens with home to parking, parking to registration, and returning to parking. We did this during COVID also to provide social distancing options, to allow people the ability to self-navigate, to self-wayfind. Our goal is to provide the kiosks in the hospital, and then we're going to be working to enable the blue dot-like experience for individuals on their smartphone. We empowered our inpatients through really cutting-edge technologies. One of the ways we did this was through the My Methodist patient tablet, really providing tablets to our patient rooms, helping our patients navigate with this technology, using tools that are near and dear to them, like MyChart, but also enabling them the capabilities in their inpatient stay to see their care team, to order food off a menu and see it, and to be able to interact with their food ordering in a way that hadn't been possible before. Our patients were able to also take advantage of entertainment options. These are just a few of the items that are representative. We've expanded it more. But having patients who've not brought their own smart device, being able to have that entertainment, or have access to a health library to understand different information that's going on either about their current care or care they might be planning about. And security is most important, allowing patients to automatically erase this themselves, but at the end of their visit, it's always erased as well, automatically on discharge. We rolled this out to over 1,100, and simultaneously, we really knew that smart speakers have a future. The future of voice has really come around. We partnered with Ava Health, again, another industry leader that focuses on a technology to use the smart device in the patient room with hundreds of skills that they're able to call out. Now, most of the time, people used it for what they know to use it for, which is music. But that's great. Reducing stress, listening to something that's comfortable, searching for knowledge articles, socializing. But we also enable the ability for patients to phone any number that they were wanting to call within the United States. And that really made a great hands-free option for patients to communicate with loved ones. Automation is absolutely critical. Josh spoke earlier about helping our staff be able to work at the top of their license. One of the ways in which we're making life easier for our nurses and physicians, we implemented, honestly, what I think is a no-brainer, real-time location services by Intelligent Locations. It's helped us with asset management. It's helped us with environmental monitoring through monitoring all of our COVID refrigerators. We're looking at other use cases, but honestly, it was just so very easy to implement that it made it very scalable very quickly. We rolled this out in tandem with all of our My Methodist patient tablets so that we could locate them, ensure where they were, and ensure they weren't getting lost. It really made a huge difference. The role of bots. Intelligent automation is here, and it's really important to utilize this capability to remove the mundane, day-to-day, copy-paste type functions that our staff are doing. Not only does it free them up to do great things, but it also speeds up the time it takes to do otherwise very long work. This is a great example of having an automation platform, ours is WorkFusion, where we needed to have claims submitted. We submitted about 800 of them, and it took about 2 days to submit these, and the outcome was $16 million in charges. We were asked recently, would we have had the same outcome? Well, this was a first in, first out type of use case with the federal government. And honestly, during COVID, we didn't have the staff to address this. So likely it would have gone unmet. Lots of use cases. I encourage you in your organization to think this through. It's not easy. The toughest part is going to be for you to really look at your processes, standardize them. But it's going to be great when you do implement intelligent automation. Voice bots on our telephone lines. It seems natural. We implemented voice bots really to handle the number of calls that were surging into our call centers over the period of the COVID. Many of these were very predictable, and many of these had similar response needs. The automation we built in was very smart, and over time got smarter because it was listening to the types of calls being asked and where it needed to route it. We've implemented it in our hotlines and our COVID main lines, and now we've been rolling it out in other lines. Our goal is really a vision where a voice bot is smart and intelligent and is implemented at the very top of all of our calling trees. It's really going to be great for the patient because it'll reduce the number of transfers. And you can see the statistics on the right side, how many calls were handled for our COVID hotlines, and we're using it with employee health as well. Many of these great automations were handled at the time of COVID, including contactless temperature screening. I'm sure we've all experienced this, and we probably all implemented it at our hospitals. We still have it up today. It does serve a purpose. We also have digital attestation platforms. Again, back to text, sending a text notification to our patients before their visit, having them take a very basic attestation, and then it shows kind of a green is clean for 24 hours opportunity on their smartphone, where they're able to show it upon entry, and we know that they're doing okay. The role of digital care pathways can't be underscored enough. This is one where we partnered to create a really special opportunity with a standardized set of information that is sent out to patients in bite-sized chunks through text, phone, and email. If you take a look at the left side of this, the statistics are incredible. Almost 4,300 patients, 98% approval rating, 80% patient engagement. There's unheard of results here, unlike anything we've ever used before. So much so that we really look at this to be one of the breakthroughs that we've enabled during COVID. And you can see all the accolades here from patients. I hope that you'll look at this and think about texting, whether it be care pathway, whether it be texting schedules. It really is a way to deliver information just in time in bite-sized chunks to help people in their care. Josh, back to you.
Awesome. Thank you, Brad. I'm excited to share the strategy around clinical voice technology. Brad talked about transformational tech. I want to share some examples that we've been working on too on the clinical side. Just recently, probably it's been a year now since the announcement with our partnership with AWS to build some revolutionary ambient voice technology, as well as some OR command technology. The opportunity is there. We believe at Houston Methodist where the puck is going is towards voice command, voice speak. And so we've developed two true blue opportunities that have gone into pilot phases, or at least very close to a pilot phase. One is the ambient listening. That is where your physician and patient are simply having a conversation. The sound is captured, then transcribed. And then it's processed through some NLP, some artificial intelligence, some machine learning, possibly even leveraging some neural networks, a lot of buzzwords that are happening around the innovation space like that. But then what it's doing is it's actually producing a note. The novel part of our solution is that it's coding the note as well to help support our physicians gain efficiencies at the end of the day, bringing back a work-life balance to our clinicians. That's our goal. We've actually taken it up in pilot for 8 clinics, 8 physicians. They are using it on a weekly basis. They are very selectively picking patients where ambient listening makes sense for them to partner and collaborate. We take feedback on a daily basis, good, bad. Feedback is always welcome. It helps us to develop our product. That's part of our agile process, is to develop, learn, but mainly we're listening. And as we listen, we can try and make our technology suit the needs of our end users. And this is a very novel approach at Houston Methodist as we go down the path of building out a product. The second strategy is around the OR commands. This is something like, and I won't say it, but hey Alexa, or hey computer, please pull up information from EMR. Hey computer, please say patient's last name. Hey computer, please check in patient into OR suite. So it's things like that that we're trying to work on through the voice command technology. The next component is the technology hub that I want to share. Our technology hub is a 3,500 square foot floor on a hospital wing that is meant to showcase technologies focused on patient usability, focused on clinician usability, and we're really working to disrupt and transform and pilot the tool sets in this technology hub. It's essentially a living laboratory for digital technology. Our goal is that we can showcase technologies like virtual reality. We can showcase our ambient listening. We can showcase our voice tool sets. We can also showcase remote monitoring devices. What's better? Something in hand that you can touch, feel, and experience, or a PowerPoint presentation. Our theory and thought process is that by getting people up and engaged in the technology hub, we're able to help transform healthcare delivery. We're also able to help change the minds of those who might be adverse in adopting new technologies. This is an example of one of our leaders who is doing virtual reality in our VR room. All right. And as part as we go through our virtual experience, through COVID, we had to quickly adjust. We couldn't do on-site tours. So with some key team members, they built out a 360 tour of this innovation hub. You can actually go to our website and experience it yourself. You'll see the showcase rooms that where we're working to highlight the technologies that we can actually deploy across the system. During COVID, we deployed 80% of the technologies we were working on across the entire organization. It was an unbelievable feat during the time of the pandemic, but our goal was to support our frontline workers, those who are treating patients, make their lives easier in this unprecedented time. And we'll end on this. To be nimble and adapt is now an industry norm. To innovate is a business imperative. It's important that as these new entrants into the market, whether it be Amazon, Walmart, CVS, Walgreens, enter into our market, that we're able to continue to innovate, work alongside of these larger institutions, these more global institutions, and innovate as a business, as a healthcare delivery option. We are continuing to transform how we deliver healthcare at Houston Methodist, and we encourage you to do the same in your institutions. We thank you very much for hearing about our journey as we work on the art of the possible at Houston Methodist. Again, my name is Brad Shank. I'm sorry. My name is Josh Soul, and this was Brad Shank, and we appreciate your time. Thank you very much.